In the last 2 decades, the prevalence of high blood pressure in Nigeria has tripled. Today, it is estimated that 38% of Nigerian adults are hypertensive, yet only 1 out of 3 are receiving treatment. Because hypertension has no symptoms, many people with hypertension are not aware that they have it. Our correspondent, Angela Daku, has more.
High blood pressure, or hypertension as it is usually called, occurs when the blood pressure in the human body increases to unhealthy levels. This develops over the course of several years.
When you notice that, okay, the rate at which you breathe, there's problem with it. But before you can even do that, there's something that you would have been involving yourself before this hypertension can come in. So when your body is too relaxed, your body is not active, you don't engage in exercise, you take excess of salt, then you don't eat fruit, adequate fruit. So all these are what cumulates to form to increase the blood pressure of an individual.
Blood force, the blood pressure is high against the arteries of the heart. There is an arteries of the heart. Now, hypertension comes when there is the increase in pressure against the arteries, because there is a normal pressure that the blood is meant to be. There is a normal rate at which the pressure of the blood is. So when there is an increase in the pressure, that is when we come about hypertension.
Many adults in the world today are prone to this illness, mostly because of the lifestyles that most people live, the type of activities they get involved in, and it could also come with age, among other factors.
To know what to eat. Some diet, you have to watch your diet. You don't eat some food. You ensure that you have enough rest hour. You exercise your body. You know, hardly you will see someone that engage in sports to have this hypertension issue, because their body is always active. Then you take enough of fruit.
We must also know how to manage our stress. Stress management is a very important factor in managing hypertension. For those that smoke, you need to know that you need to stop smoking, take a regular exercise, and make sure you eat things that are natural. These days we are filled with so many junks, fast food up and down, and that are so injurious to our health.
An estimate of 1.28 billion adults aged 30 to 79 years worldwide have hypertension. The World Health Organization African region has the highest prevalence of hypertension of 27%. Also, above 20.8 million cases of hypertension in Nigeria among people aged at least 20 years in 2010, with a prevalence of 28.0% in both sexes.
When there is an increase in both the systolic and the diastolic pressure that is more than the normal one, which is 120/80. Maybe you started having something like 140/90, 180/120, and it's getting high like that, then you know that you are beyond the normal blood pressure.
We take, the person should reduce the intake of alcohol, number 1. Number 2, exercise. Number 3, the person should always be conscious of the type of food he or she takes, because it is very important, and proper medication. And the first thing the person should do is to see the doctor. That should be the first thing. They should stop all this going to chemists, asking for drug. No, they should first go to the hospital and let the doctor attend to them. And when they give them any drugs prescription, they should use it at the right time. So that's
for help. Go for medical attention. So the best place to go is go to hospital. So on get there, the doctor will carry out some assessment on you, take your blood pressure level. Then we have medications or some food that will be recommended that you should be taking. So blood pressure is not something you can take care on your own. But when you notice all those, like maybe your breathing level is not okay, you cannot sleep, then you go to hospital.
Measures to control prehypertension should be made at the point of diagnosis. Also, patients and individuals should try to avoid lifestyles and activities that could trigger hypertension and could lead to many other deadly diseases. Angela Dako, reporting for KAFTAN TV.